We will provide slides from today's presentation, and those will be available about 48 hours after the live presentation. Our topic for today's webinar is item writing basics. Our presenter for today's presentation is my colleague, Meredith Ashley. Meredith has been a registered nurse for 19 years, holding various nursing positions within acute care organizations. She has been a nurse educator in the didactic and clinical settings for over 12 years. Meredith has served as a simulation director, course level lead, program director, and department chair for the community college in Central and East Texas. In her free time, Meredith enjoys reading, traveling, and spending time with her family and her friends. I will now turn your attention over to Meredith.
Thank you, Julie, and thank you everyone for being here today. I am so excited to present to y'all today and hope that you will come away, whether you're a novice nurse educator that just started teaching or whether you're just looking for a refresher on item writing and learning some of those techniques and tactics now that we've gone fully into the NGN space. So I hope that today you find something useful that you can use out of this. Again, like Julie said, my name is Meredith Ashley, and I am a nurse consultant with Kaplan. I am from Texas, so hello to all my fellow Texans and all my neighboring states. I am so excited to have you all here. So let's go ahead and get started. And feel free to type some questions in the chat as we go along. Julie will either answer them or we'll have some time at the end to answer questions as well. So just feel free to let me know if you have any then. So as we're getting started, I have some learning objectives here just to kind of emphasize what we're going to get out of today, developing our skills and crafting effective NCLEX style questions, especially now that we've switched over to a combination of our traditional NCLEX questions as well as our NGN style questions, to gain some confidence in item writing, because that can be a scary thing for new novice educators. So that can be something that's a little intimidating. And then discover ways to avoid common pitfalls and question writing things that can trip us up or can make the question maybe not as effective at gauging the students' learning. So I just want to kind of go over some quick things with y'all today, and hopefully you will get some information on it that's useful. I will say these, like Julie said, this is going to be available in a PDF format afterwards. So if there's a link or anything that you see or something that you don't get to write down, these will be available on our website for you to grab. Here's just some terminology as a new nurse. I can remember a new nurse educator that I can remember people saying as if I was supposed to know what that meant when I started. And so that can be overwhelming at times for a new nurse educator. So one of the things that you really want to learn is, what is the purpose of your exam? What is the reason you're giving a test? We don't just want to test to test. We want to test with a purpose, right? So knowing what your purpose is for your assessment is going to be key when you're making your assessment, because that's going to kind of be what drives your assessment. Exam analysis, that you're going to hear that word a lot when you're starting out and when you're giving tests to your cohort of students. That's going to be a thorough review of your test results, showing how your students did on the questions that you put on the test. So that's going to be something that you're going to really look at afterwards. But the exam analysis should also be available if you're inheriting a course and maybe you're teaching this course for the first time and you want to see how students have done on past questions. You can go and look at an exam analysis and see how those questions tested for that cohort of students. Item discrimination and point by serial. I remember thinking, gosh, I took statistics, but I don't remember what any of that means. And basically, that's just how well your question differentiates among test takers. Your good student, your higher test takers versus your lower ranking test takers, and that all of the questions in between there. So the students in between there. There's also an item difficulty, which is, you're going to hear termed p-value, and that's just the percentage of test takers who answered it correctly. A lot of times your school or institution may have a policy on item difficulty and p-value, and may as well on point by serial or item discrimination on how you're going to use those numbers to determine if your test was a reliable test and a valid test or a valid question, and if that may need to be edited. Was it too hard? Was it too easy? Some questions we want to be too easy, like our knowledge questions that we're going to test just to make sure we want everybody to get that one right, right? So sometimes it's okay to have an easy question, but you wouldn't want a whole test full of too easy questions. So somewhere in between the easy and the hard falls what you really want your questions to be at, and that's kind of that middle of the road percentage. So your school or policy may have some of that, and we have some great resources on item analysis that you can check out on our website as well. MCQ is your multiple choice question. The STEM is the question itself. So the STEM to me is really what you're wanting the student to get out of that question. Like if you're asking an assessment question, then the STEM of your question is going to have something in there where it cues the students to look at an assessment rather than an intervention or rather than an evaluation. And so the STEM of your question is very important. And we're going to talk a little bit more about that later. The options are all your possible answers, and then distractors are plausible answers, but they're the incorrect answer. So it's going to differentiate between the student that studied and really knew the information and the student that just tried to memorize the information and may not have really learned it at an application level. And so those distractors usually get those students rather than the student that studied and really knew it at an application level. So we'll discuss a little bit more about distractors later too. There are some steps that you'll kind of want to follow when you're doing item writing just to make it a little bit easier on yourself. One is to select the objective. So what is the objective of that question? As you begin to write items, you're going to think, okay, what have I covered that I want to talk about? Maybe this is a module test that you're writing a question for. Maybe this is a question you're pulling from a question bank and going to use and you're going to reword that question to meet your needs. Then you really want to know what your objective in that is. So what have you last taught? What concept are you focusing on? What skill or task are you trying to present in this question? And then you're going to want to think about the type of question. And that has kind of grown over the last year and a half with NGN coming out. We've had our traditional NGNs, our traditional NCLEX questions, but now we've introduced a little bit more into that clinical judgment model that the NCSBN released with a new test plan. And that has given us more types that we can choose from, more case study types, more unfolding question types. And that's really given us as educators a lot more to pick from when we're trying to select the type of question. So you kind of want to go, do I want to do a traditional NCLEX question, multiple choice, select all that apply, fill in the blank, those kinds of things? Or do I want to go to one of these new ones? And I've got a slide later that kind of shows you the older ways and then the new NGN ways that'll kind of help show you that. When writing your STEM, again, that's one of the parts of the question that really prompts the student to find out what answer they're looking for. So this can be based on the test objective. It should be relevant information. You don't want to give them any irrelevant information in the STEM that might lead them astray. But you do want to give them just what they need to answer the question and pick the right answer. And that's when that distractor and that right answer look very similar. And that's when you hear the students say, but there's two that are right. Well, they really got to focus on what is that STEM of the question asking them. Because going back to that will really key in the difference between those two usually. Then we want to write the answers. That is going to be a really interesting and important part that you would think would be so easy. But as you're sitting there writing them, you're going, I can't think of the wrong answers, or I can't think of, how to make these similar in a way of formatting and length and things like that. So we don't want the distractor or the correct answer to stick out among all the rest, making it very relevant which one it is. I mean, I'm sure we've all taken tests and thought, oh, it's got to be the longest answer here. And so we don't want students to assume the answer based off of the length. So we really don't want to trick them in that area. We really want to make them very similar in length. And in nature, we obviously don't want to put a way out and left field answer, 3 of those, and then one very correct answer, giving it a very obvious choice for our students. And then we want to learn to write our distractors. Distractors are, like I said, the incorrect answers, but they're hard to see that they're incorrect unless you can really differentiate between what the question is asking. And so they can be a predictable error, maybe something that you anticipate the students might do or see in that situation or in that skill. Maybe a common misconception of something, maybe a clinical error, that doing so would cause a clinical error. It might even occur in maybe a common mistake that occurs in our hospital setting. So all of those can kind of be some guidelines to think of when writing your distractors. And then we also want to check and make sure it meets the new NCLEX standards. Can the student recognize the clinical cues? Can they identify the most important information in this question? Can they synthesize the important information to determine what the client needs? So using some of those clinical judgment steps in that clinical judgment measurement model that the NCSBN released is going to be really important to making sure that our question is really meeting what we're wanting to get out of this. Because with the new NGN, the whole purpose was to measure some clinical judgment in our new nurses as they're beginning in practice. And so are they competent in those standards? And so we want to kind of follow those same guidelines in our tests so the students are seeing our tests similar to the NCLEX test. So here are just a list of the traditional question types as well as the new NGN style question types. So you can see some of the traditional ones, which I'm sure many of you are familiar with, the multiple choice, select all that apply. Hotspot has always been one that we could have used. I think sometimes our testing software limited a lot of those, but in the past anyway. And then fill in the blank. You'll notice those a lot with your medication calculations, questions, things like that. Drag and drop, your chart or graphic questions, graphic answer, multiple choice, and then audio or video files that the student needed to listen or watch and to answer the question. And then you've got a list of our new ones. So a case scenario, you'll notice now when students are taking NGN style questions, whether it's in their Kaplan test or whether it's in their course test, they can now be built into case scenarios or unfolding scenarios. And those have the option to have 2 to 8 questions based off of that case study or that case. And so that's given a new type of learning for the student and testing for the student as they have to look through the information in the chart to find what they need to answer their question. So it's really developing that sense of real world practice into their testing environment. We have the extended multiple choice. So that's where they're going to have a significant maybe choice of questions. But here's the thing that's really become key in this one, especially, is that a lot of times this is given partial credit to the answers that are close or correct. So students have begun to see that they're getting partial credit with NGN style questions, and that has rejuvenated that part of the test. I know for them. So some of you may be doing that in your school. I know that some of our tests have partial credit. Some of the questions are partial scored. And so students will see that on their exam analysis. The close or drop down just gives them multiple choice options in a drop down menu to fill in the blank. And that helps them complete basically like a sentence. So the sentence may have blanks in them to get them to choose between, a multitude of options in that list. We also have extended drag and drop where they're dragging information or ordering it maybe in a certain way, but they're dragging answer choices, kind of like we used to do at school, fill in the blank, but you'd have a bank of words down at the bottom, kind of that thing here where they're dragging those words or phrases into the question to make it whole. There's also the highlighting text where the questions are highlighted. An area of the text is highlighted in a passage to insinuate what the question is asking. You've got the matrix grid, which is seen as multiple response question. They're a lot like our select all that apply questions, but with more than just select or don't select options. For example, they may have 8 different interventions and you have to choose if it was anticipated, non-essential, or contraindicated based on the question stem, what the question's asking. So those are definitely some new spins on that. And then there's the trend question types, which is just going to assess the knowledge of that clinical judgment measurement model and where a series of steps are used to measure their clinical judgment. So these are just kind of some choices that you'll see. You may have the ability to do this in your testing software or in the products that you're using at your institution. And I hope you do, because it's a really great thing for the students to experience these types of questions before they see them on the NCLEX. But I do have some resources at the end that I've got some links that you'll be able to click on and get some of these resources and help with some of these resources. We want, again, I mentioned about the stems being super important. And so we really want, when we're writing those stems, we really want to focus on a single problem or concept because we don't want it to be too wordy and too convoluted with information. We do want to use clear and concise language. The test takers should be able to form a possible answer after reading the stem without relying on the response options. So we should be able to say, before you look at the answers, you should have a clear understanding of what the answer may be or what you're looking for it to be down there below. We want to avoid negatively phrased stems. We want to use only relevant information, making it more succinct. Unnecessary wording and unnecessary information can lead to test anxiety for these test takers, and we already know they come in super anxious to begin with. We do want to check the appropriate level of appropriate level of difficulty, because it can, depending on the level of this student, they may need a certain percentage of the test to be an application and analysis, and then they may need some of that to be tested on their knowledge and remembering level. And so that's important that we know where our students are and what they need to be able to guide that test and make sure that our test is not too hard and not too easy, depending on where we want it. I know that we had some of the institutions I've worked in, we've had a stair-step approach to this. So as the students got further along in the program, so did the difficulty levels of these questions or the number of questions that were analysis or application. So that can be helpful as well, just kind of giving you some guidelines. And then you do want to, when you're thinking about that, consider Bloom's taxonomy, something that is really helpful when we're writing our test questions, to make sure that we are following those words and levels that are implemented for that group of students. So that can be really helpful in, like, what is best, maybe using the words what is most important, what is first or highest priority when creating your own test items. Those can help stimulate critical thinking verbiage and to help the students transition from remembering to maybe application as they're making those leaps and going further in the program. We mentioned earlier about distractors and how those are an important part of writing your test answers. We do want them to be realistic and plausible. We want them to be something that makes you think that might be a correct answer until you really understand what the question is asking. You want your distractors to be the same length and grammatically similar as your right answer, consistent with the correct answer, like I mentioned, and then inviting and well written. We don't want to trick the student, but we want to make sure that they are at the level that they understand the difference between the distractor and the correct answer. Sometimes they'll pick that one first and then they'll think, oh gosh, no, I don't think that's right. I think it's this. And when I always told students when I would teach or meet with them after an exam, is that when you go back and look at what the stem of the question is actually asking, that distractor answer no longer fits or is not the best option for that patient. And so that's something that you can remind them when you're teaching them how to differentiate between those two answer choices. They should not be close to the meaning of the correct response. It has to still be an incorrect answer, but like I said, it has to do with the stem of what the question is asking. Direct opposites of distractors or the correct answer. We don't want it to be, they should not be in direct opposites of that. Obviously, that really makes it an easier choice then. And then absolutes. You don't really want to use always or never, just like we mentioned before. And we've always been told always or never, just exclude those. So students know that. So that's not necessarily a good distractor when it uses the words always and never. Pitfalls to avoid. Obviously, the implausible distractors, it's got to be something that we want them to consider if it's going to be a distractor. Teaching in the STEM. So that might be something like saying Imodium, a diarrheal medication, that is teaching about that drug in the stem of the question. So we really don't want to do that. We want the students to be able to deduct that from their own knowledge. So they should know that that drug is an antidiarrheal. We shouldn't have to teach it to them in the stem. So you do kind of want to avoid that if it's something the student should already know or have learned in a previous class or course. I want to avoid an unclear stem. We've said that about 100 times, so I just want to really make sure that that is a really important part to getting a good test question written, and then avoid the different length options in your answer choices. Here are some tips from the National Council of State Board of Nursing Boards of Nursing. And they have just some tips on things to make your wording consistent with the ones that you see in their NCLEX test. So using client, not patient in your question. So that's a really important one. That was a hard one for me to switch to. I had always used patient, so patient came naturally to me. Using military time when you're quoting a time in a question or in an answer. It's okay to abbreviate temperature, pulse, respiratory rate, BP by using those, but you do want to spell out pulse oximetry. So some of these things are just good to know. Temperature should be given in Fahrenheit and Celsius. Remember that the NCLEX is tested in both the United States as well as Canada. And so some of our metrics may not be the same as theirs. And so a lot of times it's good to put it in both so that they can see it. If weight's given in pounds, also add your kilograms. Physician, healthcare provider are both acceptable uses for the patient's provider or caregiver. Terms orders is acceptable. Prescriptions will refer to medications. And then we only want to use the generic names for our medications. So we're not listing both generic and brand, just generic. And again, that has a lot to do with some of the brands that we use in the United States may not be the same in other countries. And so we use generic medications because that will be more consistent across the board. So when you're teaching your medications, that's a good time to start telling your students to start learning the generics and not focusing on the easier words or the brand names that they tend to want to. This is from the NCSBN's page, and this is a model or a picture of the model for the clinical judgment measurement model that was just released with the new NCLEX. So you can see that there is a lot of layers to this. One of the most important layers in test question or item writing is layer 3. And that is going to show you where the cues are and how that correlates to the nursing process. And it's color coded in that manner. So you can kind of see from here how the steps should correlate based on where the student is in the question that's being asked. So if it's an assessment style question, it's going to be a recognizing cues layer 3 spot. If it's an analysis, you're going to want to look at an analyzing cues or prioritizing hypothesis. So you can kind of see how we're not getting rid of the nursing process by adding that third layer there, but we're instead cohesively merging those together to kind of give you a frame of reference when you're writing these new NGN style questions. And we'll kind of my next 2 slides are going to go over each of these layers a little bit more in depth and what your questions are going to look like. So this is just kind of when you print this out later, you'll have like a rundown of the layer 3 and then kind of what your questions should use or should help you with as you're writing test questions based off of this level. So recognizing cues, students should be able to recognize what sign or symptom will the client be most at risk for. So that's kind of going to gear you toward that thought process when you're writing these types of questions. Same thing with analyzing cues. So I'm going to go in a little bit more detail here. For recognizing cues, these are some of the NGN question types that work best for this. And this is all recommended from the NCSBN. You can find all of this information on their website, but the close, the enhanced hotspot, drag and drop, extended multiple response really test this level of the NGN question types best. Question examples would be maybe drag the top 5 client findings that you would require follow-up. So a student using the extended drag and drop you might have a case study and you might have a list of clinical findings and which of the top 5 would the student drag over there to require follow-up. That would be an example of a STEM that you could write for that question. Really, you want them to identify the most pertinent information that is needed for that client. So that's what we're trying to figure out with this recognizing cues section. The analyze cues, there's a list of what works best here: the close, extended drag and drop, extended multiple response, and then matrix. For for example, a question you might ask is, for each of the disease processes below, identify which symptom is related. So you might have them tell you which symptom is related to which disease process. So it might have list of symptoms and then maybe heart failure, pneumonia, and coronary artery disease. And so they're going to have to pick which one of those each symptoms would fall with. This is going to analyze which symptoms are the priority to be addressed with each of those disease processes. So that can be a good question type for that one. Prioritizing the hypothesis. Here are some excellent examples of questions that you can use. An example question might be, the client is at risk for developing, and then you would list a risk factor here as evidenced by an assessment finding, whether that's a vital sign, a lab, a nursing assessment, something of that nature there. So that would be a blank where the student would then go in and pick a risk factor or type in a risk factor, and then an assessment finding that maybe they see from the drop down and could put in that blank. So that's going to be one of those questions where they have two blanks that they have to fill in from the word banks that are dropped down below, if you're using that style of question. Here, the students will need to formulate a hypothesis or a plan of care for this client. So that's the goal of this type of question, is really to develop that thinking towards a plan for that patient. Generating solutions, there's a couple of choices for this one as well. And an example question that you might ask is like, for each nursing intervention below, decide if the intervention is indicated, non-essential, or contraindicated in the care of this client. So that would be a great one. That's going to have the dots beside it where the student's going to see a list of interventions, and then they're going to have to put those dots if it's indicated, contraindicated, or if it's non-essential. It doesn't really matter in the patient's care. Students will need to be able to identify all the possible solutions, possible interventions, potential interventions for that client's care or problem. So this is a great one to do, and hopefully you can use some of these in your test as well. Take action. Here's a list of the types of questions that work. And again, this is all going to be available to you, so don't feel like you have to write this down or remember this. An example question would be that the nurse has new orders from the client's primary care provider. Click to highlight 3 orders that the nurse should perform first. So we really want in that to pick out the word first for our students. And so this is going to have them develop priority interventions in the care that they're giving to their client based off the symptoms that are listed below. So based off of what they see, they're going to highlight those 3 things, because we told them it needed to be 3. So they'll pick 3 and they'll highlight those. These interventions could help them gather information, could be gathering more information, so doing another assessment or consulting with another interdisciplinary team member. Maybe they're going to consult or request a consult with dietary or something like that. Those are all representing the nurse taking an action. So it'll be really good to remember that when you're writing these questions, because sometimes we can get focused on it needing to be an actual action that the nurse is doing with the patient, but note that it can be collecting more information as well as consulting with other team members. And then the last of the 6 things in layer 3 is evaluating outcomes. Here's the list of the question types that work best for this type of question. An example of this question might be, for each assessment below, determine if the findings show that the client's condition has improved, declined, or has had no change. So again, they'll have some assessments below, and then you have to decide if that you're evaluating if those assessments or interventions really helped improve the client's condition. So they're evaluating their plan of care with this one. This one shows them having to use clinical judgments to evaluate if the action was effective based off the client's outcome. And so these can be really helpful in that higher level of question type in the Bloom's taxonomy, to really understand if they can put it all together into a nice, pretty package with a bow and understand all of it together. Here I've listed some free resources. Again, these will be linked in the PDF that you get, but these are some of the resources from our website that have just some really great guidance, and some are videos, some are presentations, some are papers. At the very bottom, there's a template to help you design some of these NGN style questions. And remember, we are talking about item writing for a test, but these types of questions can and should be shown in your lectures when you're presenting. You want students to be able to understand how to answer these questions before they see them in a testing environment. So putting some of these in your lectures or in your course content could be a really great way to introduce the students to these, as well as give them some practice with these questions before they see them in a high stakes environment for their testing. And then also just my references at the end, a link to some of the Kaplan resources that we have on our page, and National Council of State Board, as well as some other references that I use. So I am so thankful to have gotten to present to you all today, and I'll be happy to take any questions that we have. I know I left a little time for that, so I want to make sure I get those. I've seen y'all typing and giving me hearts, so I appreciate all of that as well. And Julie, thank you for helping in that.
Thank you, Meredith. This was great information. So we did put some links in the chat, so grab those. I'm also going to put the evaluation and survey link. Your feedback is so valuable for us. It helps us to kind of create new presentations and then really look at how can we make this experience good for you and what you need. So please take a moment to fill out that survey. It does offer you a certificate of attending once you completed the survey, so fill that out for us. Any questions that we have for Meredith? We did have a few questions. I think I answered most of them through it. If I'm writing a question from scratch, how would I test its reliability and validity? That was one of the questions we had, Meredith.
So, just like the NCLEX does, a lot of times you have to put them on tests, maybe as you'll see them termed in both our platform as well as the NCLEX platform as a field test item. So you're going to get some field testing to get some statistics to prove that it's a valid and reliable question. When you do test it for the first time, or even if you're testing it as an experimental field test item, you do still get some statistics on that. So using that point by serial number and that p-value will kind of help you deduct. Some of you may use the KR20, and that's a whole explanation of things to kind of show you in the analysis of questions. But we do have some resources and past webinars that go over test analysis and how to develop good questions or know if they're good questions. And so I recommend looking at that database to find that webinar. But definitely, once you start testing that question, there's been many times where I've created a question from scratch and then tested it and thought, oh, that did not test like I thought it was going to. And so I've reevaluated it with good eyes. Sometimes I would pass it around to peers before I gave it to students in a test environment, just to kind of make sure that I wasn't looking at it from a experienced nurse's perspective and it wasn't too hard or too easy of a question before I actually got statistical numbers on it. But once you test it, even if you offer it as a bonus question or a non-tested or non-graded item, you'll still get those statistics on it. So that's kind of one of my past tips on introducing new questions that you're creating from scratch. So.
Thank you, Meredith. We have another question.
Yeah.
We got rid of which of the following many years ago, yet I have a colleague who says we should use it. What are your thoughts on using which of the following?
I mean, in some of the NCSBN examples, you're going to still see some of that, which of the following would indicate that the client is getting better or those kinds of things. I think staying up to date, I know at Kaplan, we are trying to promote test and test writing similar to what they're going to see on the NCLEX. And so when NCLEX makes changes, we often have to adapt and change as well. And so I can just think over the last 12 years as a nurse educator and how many times the blueprint for the test has come out and changed. And at one point, I remember it was like you wanted the wordy questions. And then they came out and said, no, you want as little information in the question, very succinct questions. And then now it's like, well, now we're doing case studies. And so it ebbs and flows with trends in nursing and what we're trying to get from our students as far as our evaluation of that measurement. And so I think it's okay to say we're going to change it to this direction now, but being open to the possibility of we may need to revisit that and make sure that's evidence-based and where we need it to be with testing our students and what they're going to test on at the end of the program too. So
Going back and looking at some of the questions, I think most of them are answered, but Tiffany had asked, what's the main difference between multiple choice and extended multiple choice? So I
so
believe that was answered in the chat, but go ahead, Meredith.
okay, yeah, no, I'm really the extended multiple choice is going to be where they're given partial credit for some of that. And Julie, you may have answered that already in the chat, but whereas our multiple choice, the old way, NCLEX way of having that question was no, it was just right or it was wrong. Now you may have multiple in that, almost like a select all that apply, but maybe they're going to get partial scores if they're close or if that was correct. So
Yeah, in addition, the select all that apply within GN has changed where before it would just mention select all that apply, but now there could be an in number in which they have to choose 3 or 4 options from multiple options. So in the past, select all that apply, the total number of answer options was 6. So now they have extended that to additional answer options past 6. So
yeah,
students can see 10 answer options to choose
I was
from.
going to say we're seeing letters like I, H, J, K as the list goes down, so it does extend that more, but it may give, like she said, it may give them an in number to pick from.
I have another question. Any advice on which types of questions are best for a pharmacology class for early in the program?
So I think you have to evaluate if you're teaching first semester students, that's going to be harder to do some of your application and analysis as a focus on your exam. You do want to put some of those on there. You want to introduce those in a smaller number than you're going to introduce to your senior graduating students. They should be answering mostly of those higher level questions. But I think introducing any of these can be written in an easier format or a optional format. Like I think the word bank, I think sometimes the NGN questions can be easier than our multiple choice or select all that applies from our old ones, because sometimes we're giving them options or we're giving them the assessment findings and then we're having them use their clinical judgment. So sometimes that can help the students frame the answer a little bit better than having to come up with it from their notes or scratch. They're having a case study that they're able to read and then answer that on the side. I do still think if you're doing dosage calculation, fill in the blank is a great way to capture that. And that's still going to be one of your standard options for those questions. But I really think you could adapt any of these to be maybe a bow tie might be a little bit more of a harder question, just because that can be 5 answer choices and you've got to look at it in like separate questions all under one question. So that can be a little bit more high level, but definitely some of the highlighting or the drag and drop or ordering, especially if you're teaching a set or a skill of something like administering a medication or putting in a Foley catheter, that list where they're dragging it over and putting it in order can really be helpful. So.
And we've got another question kind of similar to that related to mental health courses and nursing informatics. So I think they're looking for the type of questions that should be written. And the one thing I think that Meredith is emphasizing, it's kind of all about the level of your student and what you want your student to be thinking. So if you're doing pharm and you just need a knowledge question on a specific med, that's going to be written at that knowledge level related to blooms. So Meredith, I'll kind of have you.
Yeah, and so mental health can be a good one too. Like, I mean, depending on what you're wanting, sometimes those are your communication questions or your safety questions and some of those things. So it kind of depends on what you're wanting also to drive home. Is this something that every student needs to know and to keep a patient safe? Like, I'm trying to think of an example. For example, if I'm giving DIG, I need to know that I need to take an apical pulse for 60 seconds and listening. I want every one of my students to know that. So that one's going to be a knowledge level question, easy. They should all get that right. I should expect that. But sometimes your communication questions are a little bit harder to navigate in that area. So maybe you do want a scenario or a case set that you're giving the patient, the student, situation that that patient is in for whatever mental health concept that you're teaching. And from there, you're having them pick, okay, what are the priority safety findings that the nurse needs to know, or which of the following would be a good communication method for a patient that is experiencing this type of symptom. And so those can be great questions to use. Um, and I think the hope is that depending on what your goal is or your objective is to get out of this question, that's going to be kind of where that list of these type of questions would work well in there. So I think really any question could be a mental health question, just depending on what your outcome or goal is for that question.
Fantastic information. Okay. See here. I think we've got that. Just a lot of kudos to you. Oh, we've got just one come in. Can you clarify what's expected with hypothesis questions? If it does not require the nurse to identify hypothesis, correct?
No, it's just that gathering of information to basically start developing that plan for the patient. So, um, this is where the students are going to just start deciding what is the plan for this patient as they've done their assessment, they've recognized their cues, they've analyzed their cues. And so now what do we do with all this information that we've collected? We've got to start developing a plan for our patient. And that's what that priority hypothesis is supposed to do for them, or supposed to test on that student's knowledge. So that was the one I kind of mentioned that sounded a lot like our old nursing diagnosis, but the client's at risk for developing, and you have the student pick a risk factor as evidenced by this assessment finding. So, or this vital sign, or this lab value, or whatever the case may be that you're writing. That's just kind of how you're developing. You're getting that student to start thinking about the priority. I've gathered all this information. Now, what is my priority for this client here? So, that priority hypothesis is really just basically what is my primary problem and what is my most urgent thing that I need to take care of for this client.
Fantastic. Okay, we've got another question coming in, and your guys' questions are fabulous. So we do
Yeah, these
appreciate
are
this
great.
engagement and this discussion.
Love
Here's
it.
the next question. My class is a mix of fast and really slow learners. What is the best approach to testing their knowledge?
So, definitely, one of the things that I used to do as a new educator, and someone told me this a long time ago, is to really have your students figure out what their learning styles are. I'm a huge proponent of that because I thought I knew my learning style when I got into nursing school 20 plus years ago. And then once I was in nursing school, I had changed as a person. So had my study habits when I got into nursing school. And so that was very important for me to figure out what I was. And I thought I knew I was always an auditory learner, but I didn't really realize I was also a read write learner. And so I think just to kind of level set your class at the beginning, I would always have mine do the BARC assessment, which is the BARK assessment that can be found online. It's a questionnaire the students fill out, and it gives them their learning style or their mix of learning styles. And I think that was the most eye opening for me and some of my students as I did this over the years of teaching was that they're usually multimodal. So they're learning on a bunch of different ways. And I think what you find as some of your more experienced or older students are going to have a different background that they bring to the table than your new right out of high school nursing students that have had a different educational experience. They've had a more electronic focus. They've been testing on computers already, where you may not have that in some of your other learners. And so when a student really feels that they have found their learning style, they really can capture that confidence in that maybe what was a slow learner or what was slow to understand maybe was just a learning block because they didn't really understand how to learn better, the best way for them. So finding that information out early on can be a huge thing. So I would have my students tell me when they met with me about a test, um, the first thing I would say is what bark style are you? Because I'm going to go over this test material with you and we're going to talk about why you missed these questions. I want to make sure that I'm explaining it in your learning style. And so that can be really helpful for them.
Fantastic. I think we've addressed all the questions.
Yeah.
So thank you, Meredith. Thank you all for
God.
attending. Be sure to check out our page for the next upcoming presentation. We do have one next week related to AI. So hopefully you all can attend that one next week, next Tuesday.
Yes. Thank you all for coming, and reach out if you have any questions. So,
Okay. Thank you all. Have a great and wonderful day. We appreciate you filling out our survey for us.
yes, thank you.